First of all, we're going to talk about the second year medical students of Phramongkutklao College of Medicine. We enjoyed that early clinical exposure program to introduce them to the realities of patient care. What is the early clinical exposure program? It is a teaching and learning methodology foster the exposure of medical students to the patients as early as the preclinical year of medical college. And what is the key benefits of early clinical exposure? There are four of them. First one is making medical students academic strong. Second is improve clinical skills. The third is improve communication skills. And the last one is making medical students have more confidence to communicate with the patients. And make it shortly, early clinical exposure develop empathy, a patient-centered approach to care, and gain a deeper understanding of the patient experience. Why we have to have the empathy? Why? Empathy is the understanding and responsiveness to other thoughts and emotions. Empathy improves patient satisfaction, treatment compliance, and clinical outcome. When patients have all of this, they make gonna more likely to follow their treatment plan and feel heard and understood and do it better. Our PCM curriculum includes activities such as patient interviews, outpatient visits, and patient journey mapping. This is our example of journey mapping. And objective very clearly, we want to evaluate how humanity-based approach influence the development of empathy. Study design, we use the mixed method that divide into two. The first one is quantitative study, and the second one is qualitative study. In quantitative study, we use cross-sectional study, and another we use in-depth interview. The location is Phramongkutklao College of Medicine, and population is second-year medical students in Phramongkutklao College of Medicine, which is inclusion is individual who join in EZE curriculum in preclinical year, and exclusion is decline to participate in research. To the mixed method, we have data collection divided into first one from the quantitative study. We have data collection from online survey. We have empathy, ethical reasoning, patient-centered attitudes, and the last one is reflective practice. While the qualitative study, data collection is reflective journals and focus group discussion. Let's make more give you detail. And about data analysis, first one, from the quantitative study, have a descriptive statistic and interpretation for significant impact on students' empathy. And another one is data analysis from qualitative study. They are dramatic analysis and narrative construction. From demographic data in the results, you can see from the gender that male about 60% and female 30%. We have participant about 176. About age, we have mean at 19.95 and about prior clinical experience about 60. From the result, more of that, in the empathy assessment, we can see that they are better able to empathize with patients and strengthen urge to help others. Above like 4.1761. That means very agree about that. And the next one is ethical reasoning and social responsibility, which is about four that consider the ethical implication of actions. And next is patient-centered care and professional identity. About 4.2 understand the importance of integrating empathy and ethics. The last one is reflective practice. About 4.1818 influence how to approach clinical situations. We conclude that humanity integrating medical education enhance empathy, ethical reasoning, and patient-centered care. Key takeaway. First one is humanities enhance patient-centered care, and the second is early exposure reshapes professional identity. Implication. Educational integration is embed patient journey mapping in curricula, and global adoption is model scalable humanities program. The last key before I go out today, that is compassion is the cornerstone of excellent healthcare. Thank you for your attention. Please feel free to ask the questions. Thank you.
Thank you for your presentation.
Thank you.
You done a mixed method. I was wondering how many in-depth interviews.
In-depth interview about 10 people. I asked by face to face and asked a lot of questions to get more details about empathy.
Thank you. Another point is about the reflective journal, right?
Yes,
Is
reflective journal.
is included in the quantitative data, how you collect the data.
The reflective journal, we do it in the curriculum. We have the subject that HSS is mean health science system. So we have to do reflective journal after we go to the hospital and interview the outpatients. So we got collected from when we studied and we send this file to the teacher and I asked my friend and all participants to send it to us.
And how did you interpret the information from reflective
When we
journal?
read about the journal reflective, I see the keyword that say about empathy. They can feel their feeling of the patients, like when they come to hospital and how they feel when they feel the pain or describe about their life.
How many journal that you read?
I read about 15 journal about reflective journal.
Thank you.
Uh, Thank you for your presentation. It's very
Thank you.
interesting study because it seems that this project about early clinical exposure can enhance empathy for students. But I wonder that so you assess the outcome after the second medical year student finish the program immediately, or you just postpone for how long?
Just postpone a little bit, like 1 week or
Uh-huh.
2 weeks ago after go to the hospital.
Okay, so according to previous studies about declining empathy along medical track, so I wonder that do you have any plan to make a further study in these students that maybe after they pass along medical track, maybe third or fourth year student, this did completed empathy decline, or maybe if you plan to like intervene some program like this along the medical track.
Thank you for advice. I thought maybe further next the research. I want to do the research about the clinical year to watch that about the statistic that they have empathy more or decline. Yes. Thank you for your attention.